Good afternoon. It's great to be here in Kiel and to share my experiences with you. In this first presentation, I will be introducing the SOLAS field sites where we conducted ethnographic fieldwork. Between June and December last year, I have spent 6 months in total in the province of Northern Samar for the SOLAS project. I had never been to Northern Samar because, for one, despite its beaches, limestone cliffs, and other natural sites, this province is certainly not a mainstream tourist destination for middle class Filipinos. So, Northern Samar, or as we Filipinos call it, Hilagang Samar, is a province located in the eastern Visayas region. And from Manila, you can reach the province via a 1 hour flight that only middle class Filipinos can afford, which already indicates the remoteness of the province. One would have to fly to the next province and travel overland. You can also travel from Manila to Northern Samar via bus ride and ferry, which would take you anywhere from 24 to 30 hours. And some of my informants who worked in Manila as security guards, construction workers, and maids used this form of traveling as it is the cheapest option. So Northern Samar covers a total area of about 1,400 square miles and has about 630,000 inhabitants. In comparison, the province is just a bit larger than this county of Staffordshire, which is 1,100 square miles with 1 million inhabitants. The people of Northern Samar are called the Waray. That is also the name of their language, Waray. Tagalog, the dominant language in the Philippines, and English are also widely used and understood in the province. So in the Philippines, you have provinces, cities, municipalities, and then barangays. Northern Samar has 24 municipalities, 569 barangays. And barangay is a word you should remember. A good translation would be village. It is a demarcated neighborhood and the smallest governmental unit. As a team of ethnographers, we have been working on the barangay level, and two of those barangays were GIDA, or geographically isolated and disadvantaged areas. Northern Samar has many GIDA barangays. This refers to communities with marginalized populations, and this is determined by physical factors, such as they are isolated due to distance, weather conditions, and transportation difficulties. So these include island villages or those upland and hard to reach and unserved or underserved communities, and by socio-economic factors. So indigenous communities with high poverty incidence, or communities recovering from or experiencing crisis situation or armed conflict. The SOLAS team has worked in two areas of the province. The first SOLAS hub is Catarman, and it's on blue on the map. And the capital of the province is this is the capital of the province of Northern Samar. Its area covers about 40,000 hectares of mainly agricultural land, and it is the commercial, educational, financial, and political center of the province. It hosts the University of the Eastern Philippines, as well as an airport, the Catarman National Airport. Although don't expect too much of this, the landing strip for the planes convert into a normal road for land traffic, and as I said earlier, it might not receive Philippine Airlines daily flights for much longer. There are 55 barangays in Catarman, and we have been working in three of them. Those are Wagayway, Dimagiba, and Dontali. These are not the real names. In all the talks today, we will use pseudonyms, as is the convention in the social sciences, and these were chosen by the people themselves. The second area that we have worked in is the Lauang area. That's in green on the map. It's a rich fishing and fertile agricultural zone facing the Pacific. It is about half the size of Catarman. Its town center and island barangays can only be reached by small passenger boats, and there are 56 barangays in Lauang. And the SOLAS team worked in three of them once more. Those are Puno, Malinis, and Puroton. Northern Samar is one of the poorest provinces out of 81 in the Philippines. About half of the rural inhabitants live below the poverty line. In this table, you can see the average daily minimum wage of the different livelihood categories in Northern Samar. So for non-agricultural work, the average daily minimum wage is about 4 British pounds. For agricultural work and handicraft work, it is about 3.5 British pounds. This is far below the national poverty threshold, which is about 4.5 British pounds per day. These already low minimum wage rates are set by the government. But despite that, I have still met during my fieldwork many locals, such as porters and fishermen, who earn not only lower than, for instance, not even 3 British pounds per day, but irregularly as well. There are days when they earn nothing because there is no work to do or they are unable to work. Furthermore, from what I have seen on the ground, these minimum wage rates are just barely sufficient to support a family, and it certainly does not allow to save up for times of emergency. Over half of the provincial population has completed primary school, about 23% have completed high school, and about 6% have gone on and completed higher education. Reports showed that 73% of households in Northern Samar have access to drinking water, and 64% of households are supplied with sanitary toilets. The overall objective of the SOLA study is to understand what it really means to live in an underserved, rural, and remote area like that of Northern Samar. So we held several community engagement activities and established 4 broad themes around which we work. Okay. The yellow icon symbolizes living in rural Philippines. How do the locals of Northern Samar perceive themselves and others? What are the typical kinship and community structures? We collected data about individual and collective lifestyles, including alcohol consumption, smoking, transport, and housing. We move on to the green icon, which is all about the experiences of healthcare. How do locals access healthcare? What is the role of barangay health workers? These are volunteer health workers, each responsible for a number of households in the area. We mapped out the available healthcare providers, both the traditional healers and those in formal biomedical sector, and we were particularly interested in the etymology and local health-related vernacular and the interaction between different healthcare sectors. That brings us to the red icon. In this theme, we examined the experiences of community members living with non-communicable diseases, so the role of stigma, honor, and shame in health, illness, and health-seeking behaviors, maternal health and family planning, and local approaches to maintaining health and well-being, as well as local legends and mythology around the perceived causes of illness. Finally, the blue icon is all about the politics in health and the politics of health. In the Philippines, politics configures the provision and delivery of healthcare services. The SOLAS team has therefore paid close attention to the ways health providers and those at the receiving end of healthcare are entangled and enmeshed in the everyday play for power, taking into account that health is not solely a medical matter, but also a socio-political issue. The SOLAS team has collected data via a wide range of research activities, and you will hear more about these today. One longitudinal element of SOLAS is long-term ethnographic fieldwork. Different SOLAS ethnographers from different disciplinary backgrounds, a clinician, an anthropologist, a political scientist, and so on, have conducted participant observation. This was our main method of data collection and was complemented with one-to-one interviews and creative participatory methods such as locals drawing mental maps, barangay residents keeping a food diary, but also poems, songs, and theater around how they perceive health and healthcare. Ethnography, with its hallmark data collection method, participant observation, for me, first and foremost means being with people. But before being with people, we must necessarily first integrate ourselves and establish a connection with them. As an ethnographer, I have found that it is often necessary to proactively do this, to actively build rapport and to create interactions. Here are some of the ways by which I did this, or some things I did which helped facilitate this process. A good example of my ethnographic practice was in the days that I spent with the porters at the port of Lauang, where their work pretty much involves carrying heavy items from point A to point B. I joined them throughout the day while they worked and drank, being with them as they carried sacks of copra. This is dried coconut, which alongside rice are the main crops grown in Northern Samar. And these weigh 45 to 50 kilos and they carry these on their heads. And they shoveled and sacked loads of copra in a hot warehouse with bugs flying all around. And I myself trying and failing to do what they did, and then drinking rum, smoking, or just sitting around and relaxing in the shade when the work was all over. A lot of my data comes from informal conversations during participant observation. For instance, when I was invited by some fishermen to join them in a drinking session, one of them asked me, "Umiinom ka ba?" That is, "Do you drink?" And when I said yes, he proceeded to invite me to drink with him and his relatives, who were all fishermen. I had neither planned nor expected this encounter to happen, but when I drank with them, I felt like I got a wealth of information. They shared their troubles and how they have been experiencing what they call a panahon ng taghirap, or a time of hardship, for the past 3 years due to their ever-declining fish catches. They now have to compete with the big fishermen who operate with the full knowledge and consent of the local government. And when I asked them what kind of illnesses do they commonly experience as fishermen, I got a vivid picture of how going out to sea in their small fishing boats makes their eyesight deteriorate due to the salt water and glare from the sunlight, increases their chances of experiencing hearing loss due to the extended exposure to the roar of the boat's engine, and causes their skin to have rashes when it rubs with skin or fabric where salt water has dried up. There were times when semi-structured one-to-one interviews were the most appropriate means of data collection. This was the case with healthcare practitioners, both traditional and formal. So I interviewed 2 albularyo's, those are traditional healers, 3 doctors, including 1 chief of hospital and 1 chief of clinics, 2 nurses, and 2 midwives. When I would ask, "What illnesses do you people normally experience?" what I would reply, "Sakit sa bulsa," that is sick or pain in the pocket. In the Philippines, this is a way of saying that one is broke. I think that this is a good conveyor of the argument that poverty remains the biggest social illness, which has numerous implications on healthcare in Northern Samar. But you will hear more about this in other talks. I would like to end with one particularly fascinating interview that I had with Fredo, a male midwife in Lauang, which for me vividly portrays the hardship of life in Northern Samar and exemplifies the interconnections and interactions of what we call in academia formal and informal healthcare. Fredo was born into a large, poor farming family. He is the youngest of 10 children, and his family had been displaced by the ongoing conflict between the government and the insurgents. Fredo persevered to sustain himself throughout his schooling in order to become a midwife, but even now he remains overworked and underpaid. From counseling, functioning as a personal doctor to locals, doing faith healing to fulfilling his duties as a midwife, and advocating reproductive health and family planning, Fredo may be seen as a traditional healer and healthcare professional rolled into one. The very personal approach that he takes with the people in the communities with which he works cannot be stressed enough. In his words, in order to really help and serve the people, you must understand them, you must get to know them, you must be with them. This is the spirit we encountered in many healthcare providers in Northern Samar.